Our problem was that way back in 2008/9, the managers within Airedale Hospital decided that we needed to close some beds. And you know how it is, you look at the numbers at midnight, don't you, and decide that, oh yeah, that looks fine, we could put these patients onto this ward. So what they decided was the midnight bed numbers on ward 18, which was the gynae ward, would fit into the female surgical ward. And so that's what they did, they closed the gynae ward down. And we came up with this fantastic, we thought it was a fantastic idea, didn't we? Fantastic idea to have this all singing, all dancing gynae unit where we would look after every woman, whether they were coming in for an elective operation or whether they were coming in because they were bleeding or losing their babies or they got abdominal pain or something like that.
We started off not with a vision for how it would look like in 12 months, 2 years. We started off with a belief in how we wanted to care for women, right? We didn't have all the answers, we certainly didn't have all the space, but what we had was a burning desire to do something. So when we started off, you saw in the first thing, it was a day room and a little treatment room. Then we moved, this is Shirley here, she had a office and a waiting area. Then we moved to the 4-bedded bay, and we got our CNS. And now this is our GATU unit. There's a private waiting area, we have ensuite bedrooms and side rooms for them, and just recently the team turfed out the bathroom and turned it into a sitting room so that we could have yet another patient area. And importantly, we can fast track our patients through from A&E. So at really busy times during office hours, what they will do is the A&E consultant will just ring up and say, I'm sending Sherry Herp down, is that okay? And they're received straight through, so no more 4-hour waits at all. And GPs can refer straight through as well if they feel it's necessary. So all in all, a much more improved experience for the patients and for the nurses that work within that department and the medics as well.
When she wrote about her experience of being on ward 13 as a staff nurse and what it's like now working on the Gynae Assess and Treat. And it says, I am beyond thrilled that people are taking notice. I really appreciate the support I have had from the matrons, Denise and Sherry. Airedale is such a huge part of my life and I now again feel that I can make a difference. I hope the unit makes you proud of our efforts. Helen.